Today I am going to take a topic which is a basic about the much more about the it looks like public health, but as we discussed, many things which are common in nature, and as a hospital administrator, you must aware all these kind of things as a knowledge part of also, and same time this can be implemented uh, in the hospital also. First thing is the healthcare. How we can define the healthcare? It looks a very simple word, but in the public health scenario or the hospital admission scenario, it has very widened meaning. Technically, it is organized provision of the medical services to maintain and improve health. This is the ideal kind of definition. And what is the aim for this healthcare? That is the promoting, preventing, curing, and rehabilitating the health. All these four components, they are just a part of healthcare. It is not only the diagnostic or the clinical treatment which comes into the healthcare. Much more important part is the promotion and the prevention. That is very important part. And baki rest of the part, cure and the rehabilitation of the health, that is slightly on the clinical part. But this promotion and prevention is very important. And why it is very important, particularly in the context of this our India country? Reason, even all these facilities, even the Ayushman Bharat, and even the various health insurance schemes, various private health insurance scheme where the people are doing the prepayment, still we have huge out of pocket spending. Means it is approx still 40 to 60% out of pocket expenditure is being done by the Indian personnel, in spite of all these kind of coverage. And this promotion and the prevention aspect, it is the one thing which can reduce the out of pocket spending in the later stage. If you start using this preventive care and all that, the later on you don't get into the some complex kind of disease which has high price expenditure, where the high price incurred for getting the treatment or for the diagnosis and all this kind of thing. So that is a very important part. And because of that, only primary healthcare concept is also being came into the existence in 1978 at Alma Mater conference, which has been done in the Kazakhstan in 1978. So that primary healthcare concept has originated from that place. So we can see everything in the healthcare sector, or whether it may be in the private or any or public, we only dealing with this healthcare. Ultimate aim, whether it is doctor, whether it may be the hospital administrator or the manager, everybody's focus is just to provide the quality healthcare services. The outcome should be, outcome is something like that which can satisfy the patient in a very quality manner. We cannot say, and this satisfaction is a it's a very subjective kind of things. One may be satisfied with the same thing, one may not be satisfied with the same thing, and it is very common in the healthcare sector. Somebody gets operated in a particular hospital for some joint replacement, his recovery or his quality of life is good after this surgery. He will appreciate that the procedure is good, it has enhanced my quality of life care. And same time, because of some reason, every individual has a different kind of component, different kind of constitution of their mental, physical, and the social things. So that also impact. It is not only that you got a very good clinical expertise and good clinical services, and your outcome is going to be phenomenal. All these factors, this social factor, cultural factor, emotional factor, all these factors, they play a very important role in the outcome of the um, this clinical care. Okay, and healthcare as a it's a considered as a basic human right in the 1948 by the WHO. And after that, the countries, all the globally, all the countries, they started heading towards this providing cost-effective healthcare. Okay. Now we talk about this. What is the effective healthcare system? What is your concept? What do you think? What is the effective healthcare? If somebody asks, what are the features of as a patient? What do you think? What is the effective healthcare?
Sir, effective healthcare means firstly, we should be having the facilities, sir, and facilities to take care of the patient, and then which includes the diagnosis as well as the clinical treatment as well as the lab treatments and other things. And
Mhm.
secondly, the effective healthcare system should be the knowledge to the general population what is actually the healthcare is. That is the
Mm.
prevention as well as the maybe the prevention only, sir. And
Mm.
cure is now that comes to the healthcare system only, sir. That is inside the
Okay.
hospital. So
Mhm.
effective healthcare system can be, as per me, it can be that only, sir. So
There are many more things, and
yeah,
already I have told you one thing that is very important thing. If you think some, pride and horizon, whatever you have told, that is also correct. It is not
yeah,
like it is not correct. But one thing I have told you first, the issue hai in the healthcare sector, there is a problem of the inequity. The
yeah.
person who needs more medical care, actually he doesn't get that care. The
Yes,
maximum healthcare services, they are limited to the upper income group or something like that. And irony is that ki upper income group person, they are more unsatisfied in terms of the person who is in the lower income group. That is also there. While as the maximum facility or the good quality facility that is being availed by the high income group. So that is a study. That is interesting study, and a lot of reasons are there. Matlab we can debate on this issue. Why the higher income group people, they are more unsatisfied in comparison to lower income group. Okay, one reason, just for inciting you. One reason maybe there, when the this comes to, because higher higher income group, they are just thinking ki they are contributing a lot as a tax and all that, and if they are paying more as a tax, they definitely deserve the best care and all that. So that is the one main cause ki they think something like that, and there are many other causes are there. We can think upon that, and we can do the lot of discussion on that. The first effective healthcare system, one is the universal accessibility. Accessibility is the very important, means health for all. Everybody. It is not like that you have a very good doctor, you have a very good kind of facility, international kind of facilities, cost cutting technologies and all that you have. But even if people they are not able to come to your facilities, then there is no use of this facility. Okay, and same time you have to increase the coverage. It's a part of the public health, how we can increase the coverage. If we see in the remote areas, uh, specifically in the northeast region, there are now prevalent uses of the drones. They are supplying the machine, they are taking the sample, they are supplying the bloods and all that. So that coverage, how we can increase the coverage, that is also the part of this effective. Okay, we have facility, but even we are not able to cover the population, that is not effective. Equity in distribution of resources is very important. Whatever the resources we have, it has to be equally divided into the person. And what is the meaning of health equity? Equity means if somebody needs more care, he should get the more care. And equality is the just opposite word. Whether I need that care or I don't need that care, but I am getting the same thing. So that is the equality. So always in healthcare we talk about this equity, where the person who needs more care, he should get more care. And if person doesn't need care, then of course usi hisab se, according to that services to be provided. Then community participation, ये भी, this is one very important point. Effective कोई भी healthcare, it cannot be become effective until unless community participation is not in the designing of healthcare system, or some kind of uh, suggestions for the community. And this differs from community to community. We cannot think it's going to be same in the part of Madhya Pradesh, and it is going to be same into some remote area of the Chhattisgarh or the northeast region. So that community part is when you include the community for deciding how they should get the health care services, then it is going to be effective. And you just started your facilities and communities, not bothered, community is not involved, they don't need that facility, and you have started, that is not going to be effective healthcare. The community participation is very important. Then whatever the healthcare system is there, that should be preventive, promotive, curative, and rehabilitative. Only one thing cannot make the system effective healthcare. You have a very good curative kind of facilities, you have a phenomenal doctors, you have very latest kind of technologies, AI based technologies and all that. But if you are not considering this preventive and the promotive part of the healthcare, it cannot be considered as the effective healthcare system. Then cost effectiveness and the quality assurance, it is again the major issue. As I told, out of pocket expenditure, the financial protection is very important. And government should provide the financial protection to the individual, so that in the time of need they should get the treatment at a very reasonable cost without taking so much of burden there on their own pocket. Why? Because then ultimately this out of burden, out of pocket spending, that converts into the catastrophe of the health. And what is the catastrophe of the health? That is the health expenditure, that is also known as the CHE. When the certain part of the income that goes, and there is again a very researchable topic, because it's both lot of literature is there. So there are two criteria when the expenditure of the income that is more than 10% or the 25% of the expenditure of the other things which you are doing for the services or for the food and all that. So that when this 10% crosses, then it is considered as the catastrophic health expenditure. In certain criteria, there are 25% also taken into the other part of the world. But normally in India, we consider it something like 10%. If I am earning 100 rupees and I am spending 40 rupees on this services and the food part, and same times I am spending 10%, more than 10% of that part, then it is called as the catastrophic health expenditure. And that is a big problem in the India. And finally, this healthcare catastrophe that converts into the impoverishment. One means you start selling your assets, you start disposing of your things for just getting the medical care. So it is very significant that government should make such kind of policies or such kind of programs which can provide the maximum financial protection. India, mein, there are a lot of schemes, but still there are a lot of groups and lot of community which are just left. They're not being covered from any kind of resources for their healthcare need. Only they have to dependent on the government resources. And you know the what is the scene of the government load and workload. They are not getting the chance. And then we talk about this goal of the healthcare: improve health outcomes and the quality of life, reduce disease burden and the mortality, and the ensure financial protection and the equity, and strengthen responsiveness and accountability. That is very important. Means, what does it mean to strengthen responsiveness and the accountability? That is the part of the government officials. If community they have some kind of because of some reason they need anything, government should be responsive enough to provide that kind of care. The same in COVID. If I take the example of the COVID pandemic, initially government they were not looking into the arrangement of the these gases and all that, and people were just suffering. Okay, but later on government came into the action and they decided some policy. They started managing the supply of the oxygen, supply of the drugs, and even in the later part they started the managing the bed also. Okay, how many beds are available in the private sector and the public sector for giving the care of the ICU. So this is the responsiveness, and that responsiveness is very important. If government doesn't understand what the people, what the citizens want, and they just become indifferent, then that system cannot be called as an effective system. And accountability should be fixed. In private, there is a kind of accountability, but in the public sector, this gross lack of this accountability. Doctor is posted there, he may not be available in terms of the time. Today we are discussing these things. As I am working in the ECHS, the timing is from 8 to 4, and one more civilian doctor is there. तो एट 3:30 तो सर सर चलो सर टाइम हो गया निकलते हैं। हमने कहा नहीं अभी टाइम नहीं हुआ। एज पर द our setup, it's a 4 o'clock is the time is 4 o'clock. So something like that. Well, people are there. I understand you also know this thing. There are resources crisis and all that. But problem is that whatever the resources we have, even they are not being optimally utilized. People are not doing their job, then they're not performing what they're supposed to do. So that is because of lack of accountability. So if system doesn't have this responsiveness and the accountability, then it is not going to be effective. And these responsiveness and the accountability, actually, it is the it is the job of the managerial kind of person, means somebody in the government or something like that kind of, they can only do such kind of things. Okay, now we talk about the level of healthcare. What can be the level? So this I think it's a very common thing, there are three type of care, that is the primary level, secondary level, and the tertiary level. And what is the primary level? That is the level when the first contact, the patient, he has some individual has some kind of problem, and he just approached to a nearest public facilities or something like that for getting some treatment, or for getting any kind of investigation, basic investigation. That is the first contact point, basic care. That is the primary level. At the secondary level, where these specialist services are also available and specialist investigations are also available, and the tertiary level, it becomes very highly advanced super specialized care, and it can considered under the medical college or higher research institute. That is the tertiary level. In terms of the public health, we just see in the hospital part also, what is the primary level of healthcare? It is in the public sector. It is provided at the sub centers, Ayushman Center. You must have heard this. Then primary health centers and the various community clinics, which is being run by community people, or sometimes some NGOs. They are also supporting this to provide the basic kind of treatment. So that is the primary level of healthcare. And what is the focus at the primary level? Basic prevention and the promotion. It is very important part. That is the basic job at the primary level of healthcare, because there are not specialized care is available. There are basic kind of expertise who are available at the primary level. The job is that you have to you have to do this prevention and the promotion part, and you should look after maternal and child health, immunization, sanitation, hygiene. All these actions, they are being done at the sub center or the Ayushman wellness center. वहाँ पे इसी टाइप की एक्टिविटी होती है, where there is no doctor at the sub centers. And at the Ayushman Wellness Center, there is no actually doctor in the public healthcare sector. That is being managed by some Ayush kind of doctor, or sometimes it is being managed by some senior nursing staff. Of course, they are being monitored by the medical officer who is sitting at the PSC or the CSC. And staff, medical officers, ANMs, health assistant. Medical officer is available. It start available from the PSC level. They are not available at the sub centers. Sub centers, there are different names. One is the Ayushman Center, Ayushman Mandir. All these are the sub centers. Okay, and sub centers are the two types. One is the rural sub center, and now the government, they have started this urban sub centers also. So at this place, there is no medical officer is there, but at the level of the PSCs, medical officers, they are start getting posted and all. So that is the primary level of healthcare. And then we see the secondary level of healthcare. Under this secondary level, we consider as the district hospital and the community health centers. Okay, and these are the first referral unit from the primary level. Whenever the patient is sickness is beyond the expertise or beyond the qualification of the primary level manager healthcare providers, patients are going to be referred in case of high risk pregnancy, in case of any critical case, something like that. So all these cases, they are referred to the district hospital and the community health centers. And as I told you, this is the some specialist kind of services. So a lot of specialists, they are available at this hospitals and the community health centers, and a lot of staff, trained staff, means जो primary health centers and Ayushman centers पे you don't have, means OT technicians, a lot of other staff, X-ray technician, all that kind of thing. They are available at this secondary level of healthcare. Then we talk about this tertiary level of healthcare, that is the Apex Institute, and we can call it as the medical colleges, teaching hospitals, and where the super specialized kind of services, cardiology, neurology, oncology, all these kind of these are the super specialized services which are available. So these kind of centers, they are called as a tertiary, and this structure is also applicable in the private healthcare sector. Big corporate hospital, they are actually all the tertiary level of hospital, because they have all kind of super specialized services. And we can see this second nursing homes and the small clinic, they can be considered as the secondary level of healthcare services, where the specialists are there but super specialist facilities are not there. And it's again it is again a debatable topic when we talk about the mm, empanelment. When we send our patient, when we send our patient for getting some kind of treatment, who are financially secured, some insurance or some government scheme on, or some social health insurance scheme, they are providing some financial protection. So in that situation, if the people goes to the impaneled hospital, now we can debate that whether this tertiary level of healthcare is supposed to be impaneled, or the secondary level of the healthcare services to be impaneled, or the primary level of the healthcare services to be impaneled. So this is again a research kind of topic. We have to see, we have to collect the data and all that, and we have to see the cost part, because ultimately everything, every financing, whether private or the public sector, government has to play some very important role for making the services equitable, so that people in the country, they are getting the services under what category they are covered, maybe the social insurance and non-insured, or some other kind of insurance is there. So that is very important. So this is the tertiary level, and they actually focus most on the advanced diagnosis and research, and the training part is an important component of this tertiary level of the healthcare. So if we take talk about our scenario, defense forces, we can label army hospital RR, that is the tertiary level of healthcare services, where a lot of research, training, and all that kind of things are being conducted. Various kind of command hospitals are there, which are also there at the level of the tertiary level. If there are super specialists are posted there. Then we come to this concept of health for all, HFA. And that concept is introduced by the WHO in 1977. And purpose is that to attain a level of health that enables all people to lead socially, economically productive lives by 2000 and beyond that. And it can be only possible by this primary healthcare approach. So that is the aim. Initially, when this primary healthcare approach was told by this conference, Alma Ata conference in 1978, people or the world, they were not convinced that this is going to help the community or help the country. But later on, everybody started realizing this primary healthcare approach and the concept is very important part of the healthcare system. And if we're not utilizing this approach, then we have to face a lot of financial hardships. We have to face a lot of inequity in the services. We have to face healthcare financing issues. A lot of things are there. Then this, what are the principles of this health for all? One thing is that equity and the social justice, that is very important. Equity, I told you, the person who needs the services, they should get, and there should be no discrimination. Where social justice means there should be no discrimination. There are a lot of marginalized and the vulnerable group also in the society. Just we can take the example of the beggars. We can take the example of the sexual health workers. They are not coming to the centers. Why? Because they feel when they come to that center, they are being discriminated. Okay, lot of intersex people, they're also not reporting to the healthcare. Even they are suffering, but even they are not reporting to this getting this healthcare services. So that also government role is there. They should just ensure that kind of discrimination should not be there. And as I talk about, the coverage is important. If people are not coming to you, then the government responsibility and the organization responsibility is that you should reach them. Ultimately, aim is that they should get the facility. And if they're not coming to your centers, yeah, they're not coming to your hospitals in the private hospital, so what you have to do? You have to go to them. आपको वहां पे अप्रोच करना पड़ेगा. You have to extend your services up to the grassroots level of the community, or the grassroots of the community people who are maybe discriminated, or the marginalized, or the vulnerable kind of people. So that kind of things is required. Then intersectoral collaboration. There are health, they cannot work in silos. Lot of other sectors you have to involve, and one of the important sector is the school education, where the lot of medical education is being mandated. If you talk about this in the government sector, adolescent education program, medical health education program, they are being conducted in the school. And various sanitary related, menstruation related issues, which are being now conducted in the school to teach the girls of that particular group. So school is one thing. Same times, if your hospital or your facility is running in some, so in the some community, the community head is also supposed to be involved as gram panchayat. If we talk about the local level, then the other organization, maybe the gram panchayat. Same time, water department, because you are dependent on the water supply, and water is one of the most potent source for, uh, if it is not being managed properly, it may be some potent source for some health hazard or something like that. So like that, there are a lot of sectors they are involved. You cannot work in silos. Even the private also, you are dependent on the vendors for the supply of machine. You are dependent on the vendors for the supply of the equipment. Is तरीके का lot of things. For that you are dependent on somebody. You have to dependent for the gas supply and all that kind of thing. So that sectoral collaboration is very much important. Then this is important, or the interesting thing, appropriate technology. And many people, they think that technology means that's machine, that's all. They're considering that machine is only considered as a technology. But in the healthcare technology, that is a different subject. Actually, healthcare technology is a independent kind of subject. And that healthcare technology, that considers not only the equipment. Healthcare technology considers any innovative ideas, any good policies which is going to help the patient, or for the community health, that is being utilized for the community health. So any kind of innovative ideas, any kind of education, health education method, any kind of healthcare equipment, they are considered as technology. What do you understand by this appropriate technology? Why this appropriate words are used? Because sometimes what happens, if we think that technology is good, but because of the cultural practice or something like that, people, they are not utilizing that. If I want to give you some examples, just take the example of the sanitary napkin in the village. Initially there was lot of resistance. Now you talk about इसमें क्या technology, but all these I told you, all the things which are being utilized for the benefit of the community or the public, they are considered under the healthcare technology. And proper word is that how the healthcare technology is useful, what are the various effects of this technology. They are all considered under the health technology assessment, HTA. That is called HTA. And now the government of India, they have constituted a separate organization who deals with health technology assessment, and that is called as the HTAIN. If you just search on the Google, you will get all the information. So what the health technology assessment is, that you can come to know in the detail. That is a separate course on this health technology assessment. And fortunately, I have done that course also, health technology assessment ka. And there is one a big organization in the Tamil Nadu, in some part. I'm just forgetting the place. There is one big company, that is AMTZ. they are involving in this technology development, all that kind of thing. So there was a significant resistance from the people for adopting these sanitary napkin practices. So that is the failure of the technology. Means you can say that technology is not appropriate for that community until unless you make them aware why they should use this sanitary napkin. Means you have to increase the acceptance of that. And if people are not accepting, that technology cannot be considered as a good technology. As a there are some kind of socio-cultural things are there. Women, they are not coming to the facility for the delivery part. They just think कि घर पे ही हमें delivery कराना. That is the society culture and all that. Even the facility is available nearby. That is again the technology failure. You are not able to you are not able to utilize that particular facility. So that cannot be considered as the appropriate technology. So that is why this appropriate word has been used, and that that differs from different community to community. But ultimately, just initially with see the in even in the COVID-19 vaccination when they started, there were certain kind of resistance in a particular part or particular community or the religion. But later on, government succeeded to convince them also that this is going to be good, this is going to be safety for you, and people started using that. So that role we are supposed to play, whether you are in the public sector or you are in the private sector. Then community participation. Again, I told you on these aspects. These are the basic the principles for health for all. It cannot be going to be realized or the translated in the ground until unless these all features are not included. And then the focus on the primary healthcare, which reduces your out of pocket expending, and all the middle income countries and the LMICs, lower middle income countries, they are facing this out of pocket expenditure significantly. That is one of the biggest challenge. And why we are facing, why the countries are facing, because it's very difficult to assess exact estimation of how much amount is being incurred as out of pocket expenditure. हम उसको एसेस ही नहीं कर पा रहे हैं कि कितना हम कंट्री में एग्जैक्ट असेसमेंट एस्टिमेशन वी आर नॉट एबल टू डू दैट कि हाउ मच अमाउंट इज बीइंग स्पेंड on this out of pocket expenditure. And again, at this place I want to tell you, most of the time people are confused कि what is the out of pocket expenditure. Suppose you have taken some private insurance, paisa is going from your pocket, now you can consider this is also out of pocket expenditure. It is not like that. In economy and in the this global research part, out of expenditure is considered only when you are paying from your pocket, when you are availing the services. I went to the doctor. I went to the doctor. I took the consultation, and I paid him the fees. Okay, so that is out of pocket expenditure. And whatever the money I am giving for my insurance, that is called voluntary prepayment. That is not considered as out of pocket expenditure. So out of pocket, so you must understand what is the difference between this out of pocket expenditure. That is why if we talk about expenditure in the healthcare, there are three sources maybe in the healthcare. One is the government resources, they are pumping the machine. Second is the private healthcare, that is, and third may be the external. You are getting some kind of donation, some kind of fund from the outer agencies. It may be the WHO, it may be the UNICEF, it may be the World Bank. So there are three major resources of the healthcare financing in any country. And this private part considers the insurance part, means voluntary payment, social insurance, all. And second major part is that is the out of pocket expenditure. So when you say कि private health expenditure is very high in the country, okay, yeah, very low in the country, so you cannot directly say कि it's a good or it's a bad, because it has two components. One component is the good component, that is the voluntary prepayment, and second component, that is the out of pocket expenditure, that is the negative component. Okay, when we talk about this voluntary prepayment or the insurance or the social insurance for which we are paying the money, you are financially covered. You are financially protected. In the case of emergency or in the case of need, you are not supposed to spend the money directly from your pocket. So that is the basic difference on this out of pocket expenditure. And in many part of the India, even the people, they're not giving the cash money. Some in some places they are giving, they offer for their treatment. Sometimes they offer the chicken, they offer the grains and all that. In lieu of that, they are also getting the service. Now you can imagine how all these expenditure can be estimated. And there are a lot of other things also in, like India country. There are jhadfuk, there are jarutona, all these kind of activities people are preaching. And definitely they are giving the money to them also, they're not doing anything free. But that particular expenditure estimation is highly difficult. That is the biggest challenge. And how we can improve that, that is the, again, a researchable topic. What are the, and if somebody has any kind of idea, some innovative ways and means to improve this thing, it's going to be help a lot for assessment of the financial expenditure in any country, which is called as the national health accounts. Okay. Then we come to this Alma Ata Declaration 1978, where this has been declared, uh, concept of the primary healthcare, health for all by the year 2000 through primary healthcare, and health is recognized as a basic human right. And essential healthcare based on practical, scientifically sound, and socially acceptable method, made universally accessible to individuals and family in the community. This is the definition of the standard definition of the primary health care. Primary health care. Now you see the word by word, it has to be practical. It is something not like that you are working in a very different difficult terrain and you are providing such different kind of services which are not needed there. Whatever the requirement of the community, you must focus on that. Scientifically, it has to be proven, evidence based. It is not like that you start giving any kind of treatment for the sake of health for all concept. Socially acceptable methods, that is the, I told you already ki sometimes why the technology or failed. So you have to also see this thing, and made universally accessible to individuals in the families in the countries. So the any time somebody wants to achieve that facility, they can achieve. That is the concept of the primary health care. And all these primary healthcare services which I told you, primary healthcare centers, district hospital, community hospital, they are working 24 into 7, where anytime anybody can go and seek the treatment. Okay. And now we talk about this core principles of this primary healthcare: equitable distribution, community participation, intersectoral coordination, use of appropriate technology, focus on prevention and promotion. These points, they will come into many places in a different context. तो बेसिक का जो कोर प्रिंसिपल है, that is also the same thing. Equitable distribution होना चाहिए, community participation, intersectoral coordination, appropriate technology, and these all features, they're also implementable in the private hospital. If you think, just you take this point and you can think about that. If you are considering all these principles in your hospital, you are adopting these principles, you are implementing these principles in your even private hospitals, you are going to increase the footfall, you are going to increase the satisfaction, public satisfaction, patient satisfaction, and you are going to increase the satisfaction of your managers also, because you are contributing in the revenue part, revenue generation also. So these principles are very much important in both sectors. Okay. And these are some elements of primary healthcare. As a hospital administrator, you must understand what are the things which are considered as this primary healthcare element. Health education is very important. Nutrition improvement, safe water and the sanitation, specific focus on this maternal and child health, and that too you have to much more give focus on the family planning and the immunization part. Disease control is again important thing. You have to do proper kind of monitoring so that any disease should not become any endemic or the communicable. Treatment of common ailment, that should be available with all facilities, and provision of essential drugs. This essential drug concept, essential drug list, that is being decided by the government, and it is supposed to be available with at all level of healthcare, considering their role. These are the intersectoral collaboration. Already I told you that there are many sector: health sector, agriculture sector is involved, because you need for the nutrition some good food, some milk and all that kind of thing. The agriculture sector is also involved. Education, school is involved, colleges are involved for the health education. Rural development, बहुत सारे जो ग्राम पंचायत and all this kind of जो organization, they are also involved. Housing and sanitation practice, because this is also a separate kind of department. A proper disposal of the biomedical waste and all that kind of things, or proper disposal of even the general waste, that is required. And this is some example. Safe drinking water program involves public health. Engineering is also there, and there are various community sectors. They're also involved to make ensure safe drinking water. Everybody has some kind of role. So that is the intersectoral coordination. Community participation, individuals, families, communities in the planning and the delivery of the services, strengthens accountability and the sustainability. If we increase this community participation, then we can ask for the accountability. People can ask from the doctor, "Ki, why you are not present at a time." So that community participation is important. And one of the biggest example, this community participation, that is the ASA worker. They are actually the bone of this national health mission, who are connecting the people directly with the healthcare services, and they connect each and every individual from to this system. Then there is a thing that is called as the health system. And health system, you can imagine what are the things which can consider under the health system. And sectors, public bhi hai, isme private bhi hai, and there are voluntary sectors also, NGOs and all that. All these things they consider under the health system. And what are the other components? Health service delivery, health workforce, health information system, IT is also involved. Access to essential medicine, that is the pharma department, pharma or pharmacy organization also important. Financing department also involved to doing the finances for the various healthcare policies. And leadership and the governance, that is a important thing. Until that is not there, all the things cannot be managed in a very effective manner. Then health system functions. What are the function of the health system? Provisioning of the services that should be effective and equitable. Financing is again one important aspect. How the resources should be mobilized from a need, from a area where the things are already being done, from that place to the other place. That resource mobilization is also required. Stewardship means you have policy, but same time you have to also make ensure that policy is going to be regulated, that policy is going to be adopted. And resource generation, training, equipment and innovation, it is very important part. And research also, one word that has been left. Okay, you have to continuously engage in the research, as research, they are the tool which provides you a lot of innovative ideas time to time. And what are the challenges in the achieving health? The challenges are the same, whatever we have read in the principles and all. Inequity in the access, shortage of trained manpower, urban rural disparities, financial constraints, weak intersectoral linkages. That is all very important thing. Urban rural disparities, even the people who are living in the urban area, they are getting the more specialist kind of care, while the maximum population, they are living in the rural part in the India, they are getting, in comparison to them, they are getting very less kind of thing. Just say, if we take about the example of the medical colleges, south sector, they have the maximum number of medical colleges, considering the public and the private both. But if you come into this east section, there is a scarcity of this kind of facility. So that disparity has to be also reduced. Then strategies for strengthening for this PSC services को हम कैसे strengthen कर सकते हैं? The universal health coverage principle, or the approach we have to follow. Integration of the preventive and the curative care, it should not work something like that. Your hospital, they are giving only the curative care, you are not providing preventive care, or you are providing only the preventive care. So there must be integration of this preventive, curative and the rehabilitative care. Good strengthening referral system should be proper. In India, actually, it is not good, because we are not working as a proper gatekeeper kind of thing. Everybody, for a smaller thing, they just approach the super specialist, which is either way, it is wrong. First, they are putting the unnecessary burden on the individual also, or the health financing system also, and same times you are consuming the very enriched and very highly skilled people for minor issues, and because of that, actually the person who is needy, they are not getting that kind of services. Then promoting digital health and the telemedicine. Telemedicine is one thing which maybe which is actually doing filling the gap of the availability of the human resources. If you have less number of human resources, less number of doctors, this telemedicine is it's a kind of boon tool which can access or which can cover the lot of population. Community empowerment is again very important. You have to make them empowered, and you have to include them in your various kind of programs, so that they can raise their voice. What are the facilities for the services they are needing? So that is one thing. Then we talk about the what are the future direction maybe in this aspect. So this is the sustainable financing model we must have. Integration of the artificial intelligence and technology is needed. Health workforce development, that is again one thought process kind of thing. And focus on the social determinants of health. And what are the social determinants of health? Which has already been taught to you. There is employment, there is a literacy, there housing, water, and all that kind of thing. They are considered under the social determinants of the health. So that is the future direction. If we talk about, that is the future direction is that. And this is a certain example of the primary healthcare. I don't want to go into the detail. And these are the important references. You can also get more information on the open website also. Okay, so this is all basic about the healthcare system in our country. And as a administrator, whether you are working in a private or you are working in a government sector, you must aware all these kind of concepts. Okay, thank you to all of you, and I hope some basic information or some basic incitement I am able to produce in you.
Thank you, sir. Yes, sir. A lot of doubts were cleared, sir. Just one question, sir. Like
Mhm.
when we talk of this, the three levels,
Mhm.
the primary level should be improved, or the tertiary level should be improved in our country, sir, as the priority as on date, sir.
This is a very good question, and actually think is something like that. If you see,
Sir.
because we are also in the field, we see if for a smaller, just individual has cough, and he just go approach to the respiratory specialist, because we don't have that kind of gatekeeping mechanism. If you see in the developed countries, in the US and in the England, for meeting a doctor, and particularly for meeting with some kind of specialist, you have to wait for 1 month or 2 month kind of things. So that is the thing. If we don't follow this approach, primary preventive approach, then the whole person, they are going directly reaching to the tertiary care. And tertiary care persons or tertiary care resources are always limited in nature. So they are most of the time they will spend in a minor kind of cases, resolving the minor health issues, and the person who needs actually that kind of care, he is going to be deprived of that. So that primary health care concept is very much important. Now it is a challenge for country like India, how we can make sure when the people should go to the primary healthcare, and when the people should go to the tertiary healthcare. That is a proper referral facility that, to be adopted. So if we talk about the example in our scenario also, if we talk about the example of the ECHS, you just go to the ICS, you will find very ridiculous kind of thing. People have just pain in abdomen. He has just problem of the dyspepsia or the flatulence, and he visited the gastroenterologist. And he is only writing the panto, rabiprazole, antacid, or something like that. And primary healthcare doctor or the facility, they are also going to write that. But even he prefers to go to the tertiary care. So if we talk about the importance, which is more important, actually both are important, but in the different aspects. When we talk about reduction of the out-of-pocket expenditure or something like that, then of course primary healthcare sector, primary level healthcare is much more important. But when we talk about the people who is suffering from some chronic or some kind of complex diseases, then of course tertiary care services, they are much more relevant for it. And there is no point to go to that primary health.
Thank you so much, sir.
Okay, I hope your concept is clear.
Yes, sir. Very clear, sir. Thank you, sir.
Okay, okay. Thank you. Good night. Good night. Good
Good
night.
night, sir.
Good night. And I am very happy with the kind of question you have asked. It means like now you are shifting from the infantry to the medical healthcare.
Yes. In fact, when you were briefing on the subject, so that was the question in my mind, sir, when the topic was
No,
being
no,
clear. So,
no, no, it's very good.
yes, sir.
I am
Thank
very
you, sir.
happy. I am very happy.
Thank you.
Okay. Thank you. Good night.